Hi everyone, welcome to our channel. I am Dr. Amit Goswami, a laparoscopic and bariatric surgeon practicing in Gurgaon with over 2 decades. One of the most common questions I get from patients undergoing hernia surgery. So doctor, tell us what is a mesh and why do we use it? So in today's video, we'll break down everything you need to know about hernia mesh hernia repair, the different mesh types and benefits and risk involved. But before we get started, don't forget to like this video, subscribe to my channel and hit the notification bell so that you never miss an update. So let's get started. So what is a hernia mesh? When we repair a hernia, we are fixing a defect or weakness in the muscle wall. So just stitching the gap closed can work, but it has a higher chance of recurrence in hernia. There where hernia mesh comes in. It's a medical grade screen-like material, or you can say jali, that we place over or under the defect to reinforce the muscle wall. Think of it like a patch on a tube of tire wear. It strengthens the weak spot and helps prevent recurrence. Types of mesh in hernia repair. There are different mesh types, and we choose them based on the hernia location, patient's factors, and surgical approach. Synthetic mesh is generally a mesh made from materials like polypropylene, and it is durable and commonly used in both open and laparoscopic repair. So there is a mesh called biologic mesh. It is made from processed animal tissues. It is absorbed by the body over time and used in special cases like infected or contaminated fields. Now, if we compare versus absorbable and non-absorbable mesh dissolve over time used in temporary support. But when you need a permanent support, we prefer non-absorbable mesh. It stays permanently, giving long-term strength. Each has its role and your surgeon chooses what is best for your situation. Let's talk about hernia mesh benefits and risk. So let's discuss benefits first. So when we place mesh, it has a lower recurrence rate. Hernia repairs are stronger and more durable. Recovery is shorter, especially with laparoscopic mesh repair. It is widely used, thousands of successful cases worldwide every day in simple or complex cases. Now, what are the risks? In small percentage of cases or when we don't follow the surgical protocol, there is chance of infection, or especially if the mesh is placed in a contaminated area. Mesh, if it is not fixed properly, it can migrate when the mesh moves from different position from its original position. It can result in chronic pain. Again, there are certain principles to follow when fixing the mesh. If nerves get irritated or entrapped during mesh fixation, then it can result in chronic pain. The good news? With modern techniques and proper placement, the risks are minimal, especially when performed by experienced surgeons. So hence, you must know how well experienced your surgeon is while opting for a hernia surgery. Is mesh right for you? Many patients ask, is mesh safe? The answer is, in most cases, definitely yes. For standard hernias like inguinal, umbilical, or incisional, mesh is the gold standard. But it's not one size fits all. In complex or infected hernias, we may opt for biological mesh or a mesh-free repair. Why? A proper consultation with a qualified laparoscopic surgeon is very much important. We evaluate your overall health, hernia type, duration, surgical history, etc. before choosing the right mesh and technique. So to wrap it up, hernia mesh is definitely a safe, reliable tool that helps us to deliver strong and long-lasting hernia repairs. While there are some risks, the benefits outweigh them, especially with modern technology and good surgical planning. Always choose an experienced surgeon while opting for a surgery and do talk about the surgery in details. If you found this video helpful, please like, share and subscribe for more videos on surgical health and recovery tips. And feel free to drop your questions in the comments below. Thanks for watching and take care for your health.